Good day, wonderful nurses and midwives. Welcome to Nurse Brainy Private Lectures. So today, firstly, I want to acknowledge God for everything. We give God praise. So today, I want us to discuss on an important topic, which is what CCF, congestive cardiac failure, otherwise known as what CHF, congestive heart failure. So this is the structure of the heart. In our Telegram group, I've explained the blood supply to the heart, and I told you in our previous class that the blood supply to the heart is totally different from blood flow in the heart. Blood flow in the heart is how the blood is flowing from the right atrium to the right ventricle, left atrium, left ventricle, lungs, and systemic circulation. That is blood flow in the heart. But as we can see, the veins and the arteries, this is the blood supply to the myocardium of the heart, to the heart muscles. So, having said that, we will discuss quickly on CCF. Now, why am I teaching you this CCF? I'm teaching you this CCF because it is a compulsory question in your nursing and midwifery council. Now, why the lecture is going on, I'm going to specify the places where question will come out. Now, one of the places where question will come out is number one, the med surg part of this CCF. What is CCF? The full meaning of CCF is congestive cardiac failure or congestive heart failure. Now, sometimes you will see questions like CCF without the full meaning. Remember, Nurse Brainy gave a full name, congestive cardiac failure, which will be simplified. Now, let us write. Make sure you are writing, very important, so that a week before the exam, you will go through it. Congestive cardiac failure. This is a clinical condition in which the heart is unable to pump sufficient blood to meet the body's metabolic demand, thereby leading to backward congestion of blood and fluid. Now, what is CCF? When you are asked, what is CCF? It means congestion. Congestion of what? Fluid and blood in the heart. Like I said in the definition, the heart is unable to pump sufficient blood. It is pumping blood, yes, but is unable to pump sufficient blood that meets body's requirements, thereby leading to what? Storage of blood, either in the lungs or in the systemic circulation. Now, this is where question comes out from. You will see questions like this. What side of the heart leads to hepatomegaly? Or what congestion of the heart, or which side of the heart leads to accumulation of fluid in the lungs? So that is what we want to note today. Are we together? When there is congestion of blood, the ventricles are pumping, but there is an inability to pump sufficient blood. And because of this inability, there is what? Congestion of blood and fluid. Now, types of CCF. Number one type is the what? We will classify this based on the side of the heart, and number two, based on function, and number three, based on duration. So based on side of the heart, we have right-sided heart failure, left-sided heart failure. Based on function, we have systolic heart failure and diastolic heart failure. Based on duration, we have acute and chronic. I come again, based on sides, we have what? Right and left-sided heart failure. Based on function, we have systolic heart failure and diastolic heart failure. Based on duration, we have acute and chronic. Now, this is where question comes out from in your exam, from these types. Many students tend to intertwine these. They tend to intertwine it. Which one is right-sided? Which one is left-sided? Now, this is not brainy shortcut. When you are asked the CCF, the first thing that should come to your mind is it anatomically, is it physiologically, or is it based on time? Brainy shortcut for CCF: anatomically, physiologically, and time. Anatomically deals with the anatomy of the heart, where we have the right side and the left side. So anatomically, you should know that we're talking about sides. So we have right-sided heart failure or left-sided heart failure. When we talk about physiologically, we talk about function. Anatomy deals with structure, physiology deals with function. So physiologically, we talk about function, and the two basic functions of the heart. The one basic function of the heart is to pump blood in two ways, either by contraction or relaxation. So physiologically, we have contraction heart failure, that is systolic heart failure, and relaxation heart failure, that is diastolic heart failure. Then based on time, we have acute and chronic heart failure. So I want to ask you, my wonderful students, what are the types of heart failure based on sides? Remember, brainy shortcut. Based on side, we have anatomically, so which is right-sided or left-sided heart failure. Based on function, which is using brainy shortcut, which is physiologically, and the two main physiology of the heart: contraction and relaxation. So we have systolic heart failure and diastolic. Based on time, we have acute and chronic heart failure. Explain anatomically, that is based on the side. Now, right-sided heart failure is when the right ventricles are unable or unable to do pump blood. Remember, blood flows from the from the SVC and the IVC into the right atrium, and from the right atrium into the right ventricle. So right-sided heart failure is when the right ventricles is unable to pump blood. And where is it pumping blood? To the pulmonary artery. So that inability to pump blood, it will make it will lead to congestion in this right side, leading to backflow. Now, whenever you think about heart failure, it deals with congestion that leads to backward flow of blood. So if the blood that is coming from this whole system is being congested here, and you note that CCF deals with backward movement of blood, that means the place that will be having problem is the systemic circulation. On your screen, the person will be having a distended jugular vein. The person will be having increased liver, hepatomegaly. The person will be having edema of the feet, ascites, because we are dealing with, that is where question comes out in your nursing and midwifery council. The right-sided heart failure, what are the clinical features? Now, for the left-sided heart failure, remember, after the blood moves to the pulmonary trunk, it is returned back by the pulmonary veins into the left atrium, and from the left atrium, it enters into the left ventricles. So, shortcut, we'll go to the heart failure based on function, which is diastolic and systolic. So, diastolic heart failure is the inability of the heart muscles to relax. Now, when someone is about to throw something from above, you have to stretch your hands to catch it. So when blood is coming in, it is natural that the muscles of the heart, we have to relax to accept blood. So, but there will be diastolic heart failure when the heart is so stiff that it can't relax. So it leads to diastolic heart failure. The heart can't relax. And if it can't relax to accept blood, it will affect circulation. Now, systolic heart failure is inability of the heart to do contract, to push blood, which is leading to what? Heart failure. And if the heart cannot relax or pump blood, the system and the lungs everywhere will be affected, because there is a certain number of blood that should be pumped by the heart. And if the heart can't relax, it cannot accept such amount of blood. And if the heart cannot pump, it cannot send such blood. So heart failure based on function deals with physiologically systolic heart failure and diastolic heart failure. On time, we have acute, sudden onset, and the chronic, long-standing, and progressive heart failure. So quickly, we look at the clinical effects. Can lead to dyspnea. It can lead to pulmonary edema. It can lead to fatigue. It can lead to low cardiac output. It can lead to ascites. It can lead to hepatomegaly. It can lead to jugular venous distension on the screen, JVD, jugular venous distension. Now, for being in this academy, you have already noted where question will come out from. If it is right-sided, remember, blood is coming from the system into the right, and CCF deals with two things: congestion and what? Backflow. So if blood is coming, if it is right-sided heart failure, that means the system will be affected, and in the system, that's where we have the liver, hepatomegaly, we have the jugular vein word, JVD, jugular venous distension. But if it's in the lungs, the blood is coming from the lungs into the left side, and CCF deals with two things: congestion and backflow. So if it is coming from the left side, it will lead to what? Pulmonary edema. So right-sided is not leading to pulmonary edema. What leads to pulmonary edema is the what? Left side. Are we together? Hope we are learning in this class. So if you have questions, drop it. Now we'll quickly dive into the pharmacological aspect of. Quickly, I want us to think rationally. Now, in this pharmacological aspect, someone having fluid and congestion in the parts of the body, what do you think we are going to give to the person as the first line of action? Let me know if you guessed it right. Now the answer is what? Diuretics. Because there is so much accumulation of fluid in the body, so you give the person diuretics. Now I will explain this pharmacological aspect in a pharmacological class. I will explain what diuretics, loop diuretics, and other beta blockers, etc. I will explain it in another class in pharmacology, but let us note this for this class sake. So the first line of action for someone having congestion is to remove that excess accumulation of fluid, and you do that by giving what? Diuretics. Example of diuretics, we have what? Furosemide, we have hydrochlorothiazide. So we give diuretics. It will lead to excess excretion of this fluid. Now the second thing we're going to give is what? ACE inhibitor, like lisinopril. And this ACE inhibitor is to do what? Lower and manage blood pressure. Because if you don't manage the blood pressure, a lot will happen to the patient. So you do what? You give what? ACE inhibitor. Like I said, all this will be explained in pharmacological class. Alright, so the next thing we're going to give is what? Beta blockers. Examples of beta blockers, we have Kevdiol, we have metoprolol. So all the beta blockers should be given to the person. The main importance of the beta blocker is to do what? To reduce myocardial oxygen demand and improve survival. So we give aldosterone. Examples of an aldosterone is spironolactone. The effect, it will lead to what? Cardiac remodeling and fluid overload. It will also give vasodilators. So this will help to what? Dilate the blood vessels in the whole body, even and in the heart. Examples of vasodilators, we have nitroglycerin, we have hydrolazine. So a quick recap of the drugs that we'll give for a person having heart failure. Number one, first line of action is what? Diuretics, to reduce excess congestion of fluid, so it will be excreted. And number two, we have the ACE inhibitor. to reduce the blood pressure, because if the blood pressure is increased, it will lead to more damage, even ruptures of blood vessels. Then number 3, we give what? Beta blockers to reduce the heart workload. It will help the heart, so to reduce the heart workload. And the next one, we can give digoxin, and we know the importance of digoxin. It's something I believe you know. Digoxin helps to increase contractility, especially when there is what? Systolic heart failure. Then we give also vasodilators to what? Widen the blood vessel, from the word vaso, blood vessels, vasodilators, to dilate the blood vessels. So if you learn something in this academy, notify me. God bless you, God bless you, God bless you. Now I have a question for you. A patient comes into the hospital with hepatomegaly and jugular vein distension. As a nurse, what is the first line of action? That is number 1 question. And number 2, which type of heart failure is that? Send me your answers now in the WhatsApp. So for those that are not in the WhatsApp, just comment your answers. So God bless you, God bless you, God bless you. Nurse Brainy loves you all. Have a wonderful day.